The amount of pressure involved in radial shockwave is about 145 psi. About. That's a little bit more than a road bicycle tyre, which are about 120 psi. And the wave is like a wave on a calm sea. Okay? Focus shock.
Flowing radially outwards from the point of impact.
That's right. So it radiates out so that by the time it gets to the deeper tissues, it's much less powerful because it's radiating out and losing its power. The focus shock wave is the opposite. That will focus in on the specified tissue and be at its maximum power when it actually reaches the tissue, which can be damaging, which is why it was developed and used for lithotripsy to break down kidney stones. So it can be quite powerful and damaging. The pressure there is 14,500 psi, so it's a huge difference. And rather than a C wave, it's a shock wave, like a sonic boom, for example. It's a sudden spike, and they're not. One is the radial is a radial pressure wave. It's not a shock wave, and true focus shock wave is great, but it's potentially harmful. So it needs to be. It's very difficult to administer. So lots of people can go and buy a radial shockwave machine and use it, whereas a focus shockwave, you could do damage with such a thing.
Conventionally, radial shockwave is the one that's available to people.
When people go for shockwave, they're typically going for radial pressure wave.
Yeah, and that's effective, though, is the question.
A lot of the research, though, is on focused,
right.
And that's where the dichotomy is. The research shows that focused is helpful, a lot less research on actual radial, but people are going for shockwave, but actually going for not shockwave. They're going for something pseudo shockwave, pressure wave. Yeah. So it's a very different beast. I think it's helpful, but not in the reactive phase. In the reactive phase, the tendon's okay. It's just been irritated and it needs to calm down. If you go in there and start doing stuff to irritating an irritated tendon, that doesn't make sense. If you irritate a degenerative tendon, that can be helpful because it can re-stimulate a healing process. Yeah. So with the correct load management, shockwave can be helpful for those awkward tendinopathies, but I wouldn't rush out. I'd highly advise against getting it for an acute tendinopathy, as it might irritate it further.